be very cautious when one comes in with any kind of a head injury, and to make sure that everything is done that is possible. Because they may have not an injury today, but it may show up later on down the road.
A lot of times folks learn how to overcome a particular obstacle in their way in terms of problem solving or taking care of themselves, and they learn it inside a rehab program, but it's very challenging to then go out and be successful at home and be successful in the community.
With a brain injury, people frequently suffer depression and anxiety as well. And very often that doesn't happen right off after the injury. It's more after the initial crisis period is over and the individual realizes the losses that they have.
There are lots of options out there. I think the key is individualizing that person's plan, having that group of folks gathered around that person, and really everybody working together to try to find the supports that are going to make a difference.
I think in therapy and all of these different areas that we've got to really be aggressive.
It's unfortunate, but at this point in time, medical science has not found a cure for brain damage, for brain injury. So most of what we're talking about when we're talking about rehabilitation is helping the individual find new pathways in their brain to work around areas that no longer function.
If you think of a 4-year-old, and as they learn new things in their life, how repetitive they are. They'll do the same activity over and over and over again. That's what's required for us to take part of the brain and teach it to govern an activity that it never had to do before. And this is referred to as neuroplasticity. It's the action of the rerouting of neurons so that an activity can become automatic for us again after a brain injury.
The severity of the injury does not translate into the same thing as the severity of the disability. And no one so far has been able to come up with any really good predictors. There's been a lot of research over the last 20 years looking for what factors, what things that would contribute to good recovery versus not good recovery. And so far, the research hasn't produced much. But the good news is that the vast majority of folks, even with really severe injuries, do make great progress.